Hello, and thank you for listening in to the Using PSYCKES Clinical Summary webinar. My name is Michelle Rahm. I'm a research scientist on the Medical Informatics team within the Office of Population Health and Evaluation, and I'll be going over today's training. Here's our agenda for today. We'll do a brief PSYCKES overview, which will talk about what PSYCKES is, who is viewable in PSYCKES, what type of data the application has. Then we'll go into accessing client-level data, so different levels of access you have to client-level data, what information is permitted versus not permitted depending on that level of access that you have. Next will be the bulk of our training today, reviewing client-level details within the clinical summary. We'll also touch base on what a non-Medicaid clinical summary is and looks like. We'll go over plans and documents, so the different types of plans and documents you can create or upload into the application. And then we'll end with training and technical support. All right, so we'll go ahead and get started with our PSYCKES overview. So what is PSYCKES? PSYCKES is an online web-based application that's both secure and HIPAA compliant. And the purpose of PSYCKES is for sharing Medicaid claims and encounter data along with other state administrative data. And PSYCKES does this by putting all of this data into a user-friendly format. And the application is really designed to support data-driven clinical decision-making, care coordination, as well as quality improvement. We do have ongoing data updates in the application. So we have our client-level clinical summary that's updated on a weekly basis, and the quality indicator reports are updated on a monthly basis. So who is viewable in PSYCKES? Now, the population available in PSYCKES is the Medicaid behavioral health population. So for Medicaid enrollees within New York State, this includes those who are currently enrolled in Medicaid or those who were previously enrolled in Medicaid. This also includes folks who are fee-for-service, managed care enrollees, or those who are dual eligible. Now for the dual eligible individuals, meaning those who have both Medicare and Medicaid, the information in PSYCKES will only be for Medicaid data at this time. So for example, if someone is dual eligible and their medications are being paid for by Medicare, those Medicare paid for medications might be missing from the application, but anything that's paid for by Medicaid would be included in PSYCKES. And then lastly, we have MAP Health Home Enrolled individuals. So these are clients that are linked to a provider agency if they're enrolled with a health home or care management agency according to MAP. And just something I want to note here is that we have 99% of the health home population in the application. Now, to be considered within the Medicaid behavioral health population, a client would need to have at least one of the following billed to Medicaid: a psychiatric or substance use service, a psychiatric or substance use diagnosis, or any psychotropic medication billed to Medicaid. But once an individual is in our population, then the information that you'll be able to see for them would be across the treatment spectrum, including things like behavioral health and medical services, residential and living support, crisis services, dental and vision, and more. We have a lot of data that's coming into our application, so our client-level clinical summary provides up to 5 years worth of data, and again, that is updated on a weekly basis. Now, the information that we get is coming from 2 different types of data sources. We have the first is billing data, so this includes Medicaid fee-for-service claims and managed care encounter data across treatment settings. And then the second source of data is from other state administrative databases, which really helps to provide a full clinical picture of the client. Now, in regards to Medicaid billing data, the time lag in PSYCKES can vary depending on a couple of things. So first, it depends on the type of information. Something like pharmacy claims, those are pretty quick and timely with a typical turnaround time of within 2 weeks from the time the client picked up their prescription at the pharmacy to when it hits our application. However, things like inpatient and outpatient services, those can take a little bit longer from the time the service was received to the time you see that information in PSYCKES. And sometimes that can be upwards of 4 to 5 months. Now, besides Medicaid billing, like I said, we have also state administrative databases that feed into our application as well. And these state administrative databases are considered real time since the lag here is 0 to 7 days. So here's a list of the different data sources that we have and where we're getting that information from. So our newest data source is the NYC Correctional Health Services data, which includes provider name, jail admission date, jail discharge date, where the individual was released to, if they were placed in jail mental health residential treatment, behavioral health diagnoses, medications at the time of discharge, and if there was a scheduled follow-up or referral. Then we also have the New York City Department of Homeless Services data, and this provides us with the shelter name, the program type and placement date, exit date along with the exit reason, and then the shelter director contact information. Next, we have the health home enrollment and care management provider information that we're getting from DOH MAP. So if a person is in outreach or enrollment, we have the name of the health home along with the name of the downstream care management provider. And then for managed care plan and HARP status, we're getting that from the managed care enrollment table. We also are receiving managed care plan assigned primary care physician data, and we're getting this quarterly from the Department of Health. Then we have State Psychiatric Center electronic medical records. So if a client has spent some time in a state PC, their inpatient unit doesn't bill Medicaid directly, but we'll still get access to that information because we have this as one of our data sources. Then we have the Assisted Outpatient Treatment, AOT, provider and contact information, and we're getting that from OMH TACT. We also have data coming to us from OMH Cares. So this is going to provide you with the ACT, Assertive Community Treatment, provider and contact information, as well as adult housing and residential program information. And then we have data coming to us from NIMERS, and this is going to show suicide attempt data. And this is actually one of the instances in PSYCKES where this data won't be restricted to a 5-year look-back rule. So what that means is if a suicide attempt occurred over 10 years ago, it would still show up in the client's clinical summary. And then next we have safety plan screenings and assessments, and those are entered in by providers in MyChoice. And then lastly, we have IMT, which stands for Intensive Mobile Treatment and Assisted Outpatient Treatment Referral under investigation, and that's coming to us from DOH-MH. All right, so in the application, we also have quality indicators, otherwise known as quality flags. So what these are OMH has identified a number of health conditions or treatment issues that are important enough that they're worth scrutinizing. So what PSYCKES does is it tracks clients who are positive for one or more of these health conditions or treatment issues. So that way the provider or the managed care plan or state government leadership can be made aware and then take necessary next steps. So these flags really help with supporting clinical review as well as quality improvement. And right now we have over 100 quality indicators in the application, and these are broken down into our quality indicator sets or buckets. So we just have a few examples of our quality indicators here on this slide. We have health home related indicators, so an example of that would be eligible for Health Home Plus, no Health Home Plus service in the past 12 months or in the past 3 months. We have medication-related flags, so an example of this would be polypharmacy, and an instance of polypharmacy would be individuals who are on multiple antipsychotics or multiple antidepressants. And then we have low adherence flags, and an example of low adherence would be a client who has schizophrenia and started an antipsychotic medication, but they didn't remain on that medication for 80% or more of their treatment period. We also have some hospital-related flags, one of which is our high utilization indicator set. So that looks at clients who have had multiple hospitalizations within the past 13 months. And then our readmission flags look for clients who are cycling in and out of hospitals. Then we have general medical. So an example of this would include someone who is on an antipsychotic but hasn't received a diabetes screening, or if someone hasn't had an outpatient medical visit in over a year, they would be flagged as well. And then we have our performance tracking measure sets, which are coming to us from the Department of Health and are run in PSYCKES with an intentional 6-month lag to allow for complete data to come in. So an example of one of these performance measures would be no follow-up after mental health inpatient within 7 or 30 days, and then no follow-up after mental health ED visit within 7 or 30 days. Now in PSYCKES, we have a number of reports available. We have our client-level clinical summary, which is our most popular report, and that includes Medicaid and state database treatment history. Again, up to 5 years worth of data is included in the clinical summary, and it's updated on a weekly basis. We also have provider-level reports. So we have My QI report in PSYCKES, and that displays the current performance on all quality indicators by calculating a prevalence rate. So you can drill into a specific indicator set and then into an indicator and review the names of clients who are flagged for that specific indicator. And you can also enable access within My QI report. Recipient search, here you can run ad hoc reports to identify any cohorts of interest. We have advanced views on the results page, otherwise known as our bulk population management views. And then on the results page, you can also enable access to a client's clinical summary. We have usage reports, so these are intended to help staff monitor PHI access. And then we have utilization reports, and these are used to support provider value-based payment data needs. Lastly, we have statewide reports, so here you can select a quality indicator and review statewide proportions by provider, region or county, client residence, region or county, plan network, provider, etc. All right, so we're going to go into accessing client-level data. So to start off, I want to make sure it's clear that clients can be linked to your agency either automatically or manually. So for a client to be linked to your agency automatically, that means they've had a billed service at your agency within the past 9 months, or they're currently enrolled in your agency's health, home, or care management agency according to DOH MAP. So that's how they can become automatically linked to your facility. They can also become manually linked to your agency. So that means that you as a provider went into PSYCKES and attested to one of the following: that the client signed a PSYCKES consent form, a DOH Health Home Patient Information Sharing consent form, or a BHCC consent form. Provider attests that verbal consent was obtained. You can also attest that a clinical emergency is occurring. And then lastly, you can link the client manually by attesting that the client is currently being served by or transferred to your agency. Now I'm going to talk a little bit about what each of these levels of access to client-level data allow. So we have signed consent. That allows you to access all available data in that client's clinical summary, including data with special protections, which is substance use information, HIV, family planning, and genetic testing for 3 years after their last billed service. So that's what a signed consent allows. Verbal consent, on the other hand, allows you to access the client's clinical summary, but with limited data, meaning that data with special protections would not be included, but you would have access to that client's limited data for 9 months after verbal consent was attested to in PSYCKES. Then you have a clinical emergency. So this allows for access to all available data, including data with special protections, for 72 hours after that clinical emergency was attested to in the application. And then lastly, you have attestation of service, meaning the client's currently being served by or transferred to your agency. So this will link the client to your agency for recipient search reports only and will not provide access to the clinical summary. So that's an important note I want to make, that attestation of service will not provide access to the clinical summary. It will just link the client to your recipient search report. We have a helpful comparison chart that really It goes over everything I just discussed, but it's a helpful way to view the differences in access types. So I won't go over it again, but this is here in case you prefer a visual comparison chart for access levels. Now, how do you enable access to client-level data in the application? So first, you have recipient search. So here you can go to recipient search in the purple navigation bar at the top. And in that recipient identifier section, you can search for an individual using their Medicaid ID, Social Security number, or name and date of birth. And on the results page, you can enable access. Or you could perform a group cohort search in recipient search. So in this example, we search for individuals that have the quality flag of 4 or more inpatient or ER visits for behavioral health cause. Here you can see on the results page, you have the Enable Access link on the far right-hand side of the screen. You can also enable access in MyQI Report. So here we've gone to MyQI Report in the purple navigation bar. We've drilled into an indicator, again, 4 or more inpatient or ER visits. And on the Recipients tab, you can see on the far right, you can select enable access to a client's clinical summary via MyQI Report. The last way to enable access would be through the Registrar menu. So here you can select Registrar in the purple navigation bar and then select Manage PHI Access. And then the first choice on that page would be Search and Enable Access for you to search for a client and enable access to their clinical summary. So I'll just show what the Enable Access module looks like. And in this example, we're going to use recipient search and search for one individual client using their Medicaid ID. You can also, again, search using Social Security number, their first and last name, and date of birth. So here we've entered in a Medicaid ID, and I'm going to click Search. And on the results page, I want to confirm that the client is a correct match for who I'm looking for. So I'm going to look at their name, their age, their address, and date of birth, along with their Medicaid ID, and make sure this is the person I want to enable access for. If this isn't the correct person, say you search by their name and somebody else popped up, since there's over 11 million individuals in the application, you can click Modify Search on the top left and update your search criteria. But in this case, this is who I'm looking for, so I'm going to go to the far right and click Enable Access. Next, you want to select the appropriate level of access that you have for the client. So in this case, we selected client signed a PSYCKES consent. And if you ever forget what these access levels mean, you have an About Access Levels link on the top right of this module that can remind you the different access levels that we have and what type of access they allow to the clinical summary, if any. So here I selected client signed a PSYCKES consent, and I'll click that blue box Next. And then I'm going to just triple check, confirm that client's identity using the top section. And once I confirm their identity, it'll say, how do you know this is the correct person? So I can either attest to the client identity as the provider, or I can note that the client provided one form of photo ID or 2 forms of non-photo ID. In this case, I'm going to attest to their client identity. And then there's a little note at the bottom just re-explaining that type of access that you'll get. So in this case, with a signed consent, we'll be able to get access to all available data for 3 years, and that renews automatically with each billed service. So here I can click Enable and go back to recipient search, or I can click Enable and view clinical summary, which will take me right to that client's clinical summary. All right, now that we know how the access levels work and how to enable access, we're going to go into the bulk of our training today, which would be going over the clinical summary. So the client-level clinical summary summarizes up to 5 years' worth of treatment history, and you have 2 viewing options. You have a brief overview, which provides the most critical information, and it's more easily identifiable in a succinct way, and then you have the full summary view. Now, the clinical summary creates an integrated view from all of those databases I described earlier in this training, and That includes information on health homes and CMAs, AOT court orders, state PC residential services, suicide information from NIMERS. All of that will be compacted into a clinical summary view. And it's organized into sections similar to an EMR. And we have episodes of care that show that are linked to detailed dates of service that also display diagnoses that were billed for and procedures. You can also export the clinical summary to Excel or PDF. So we have a number of sections that are included in that client level clinical summary. We have general information, current care coordination, notifications. We have POP, intensive care transition services. We have active Medicaid restrictions, alerts, social determinants of health, quality flags, PSYCKES registries, plans and documents, behavioral health and medical diagnoses. We have an integrated view of services over time graph. We also have care coordination, a historical section, medications, outpatient services, a newer section for crisis services. We have hospital ER information, dental, vision, living support residential, lab and pathology, radiology, medical equipment, and transportation. So as you can see, we have a lot of information feeding into that client level view, and we'll go through most of these sections today. So here's what the brief overview looks like. This is the default view when you open a client's clinical summary, and it provides a shorter, more concise view of the most critical information that that client has. So it's organized into the following sections. We have the current care coordination section, notifications, alerts, social determinants of health. We also have active quality flags. If you scroll down a bit, diagnoses, medications, outpatient providers, hospital and crisis utilization, and safety plans. So on this screen, I just want to point out what we have at the top. We have, again, that brief overview section, which we're on now, or you can toggle over to the full summary view. You have an export to PDF option on the top right. And then what I want to point out the most is our data sources hyperlink. So here, if you click on data sources, a pop-up will appear explaining all the different data sources I had mentioned earlier and what information is included with each of those data sources that we get feeding into the clinical summary. And you can export these data sources to PDF if you want to reference them in the future. Now back to the brief overview, I've scrolled down a bit on my screen. Here are all of those other sections I mentioned that are included. And then at the bottom you have an option to view the full summary, so toggle over to that full summary view, or again to export the brief overview. Now I'm going to switch over to the full clinical summary view and go through what's included in each section. So the first section is the general section, and that includes an individual's name and date of birth and address, a phone if it's from the New York City Department of Homeless Services, if applicable to that client. We have their Medicaid ID, their Medicaid aid category, Medicaid eligibility expires on date, Medicare, yes or no, managed care plan assigned primary care physician, HARP status, and then HARP HCBS assessment status. So what does that look like? Here's the general section in that full summary view. Some things I want to point out here is on the left-hand side, you have that sections drop-down. So if I clicked on that, I would see all of the available sections in the clinical summary, and I could click on, for example, hospital ER, and that would anchor me down right to that section instead of needing to scroll through the entire clinical summary. On the right-hand side, you have the option to export to PDF or Excel. On the brief overview, you only had that PDF export option, but with the full summary view, you have the Excel export option as well. And then you have a data with special protections toggle. So this would not show with the verbal PSYCKES consent, but with a signed consent or a clinical emergency level of access, you would have this toggle to show or hide data with special protections. And again, that includes substance use information, HIV, family planning, and genetic testing. So if we scroll down, next we have the current care coordination section, which is what we call the who do you call section because it has a lot of contact information included. So we have here New York City jail-based care information. We have Department of Homeless Services information if they're currently using the homeless services or in outreach. We have AOT enrollment, health home enrollment or outreach, ACT enrollment. We have health home non-Medicaid care management information or non-Medicaid care coordination. We have intensive mobile treatment, IMT data, housing residential program information, OMH unsuccessful discharge, and re-engagement alerts. So these are, this is data that can be potentially found in the current care section if applicable to the client. So here's just an example of the current care coordination section. So here you can see a few of those data pieces that I've just mentioned that can be found here. We have jail-based care, so that's going to show from the Correctional Health Services database, the jail admission date and discharge date, along with where that individual was released to. And it looks like this person has a referral to an IMT team in Brooklyn. Then we have AOT showing here, so you can see the enrollment and expiration date along with the contact information. Now the health home data, it looks like they're enrolled with the Southwest Brooklyn Health Home. You can see when the begin and end date is and their status is currently active. And then we have the main contact referral information for that health home. And then you can see the downstream care management provider that they're currently enrolled with. We have IMT information, New York City DHS shelter information. You can see that this person was receiving homeless services at Pam's Place in Queens. Their most recent placement date was in April, and then you have the shelter director contact information. So that's the current care coordination section. We're going to move on to the notification section now, and this is showing more of service eligibility notifications. So here you can see information on if there's prescription prior authorization required for any of their medications, if they're receiving Health Home Plus services, on track New York early psychosis program enrollment. So that's identifying individuals currently receiving early psychosis clinical services from an on-track program. And then you have AOT referral under investigation, mental health placement consideration. And the mental health placement consideration flag was created to help identify individuals who require an evaluation before they are admitted to certain adult homes. So just wanted to give a little bit of a background on that. And then we have POP information, Health Home Plus eligibility, and that Health Home Plus eligibility reason. High mental health need. We have OPWDD NY START eligibility, so that's for potential candidates for OPWDD NY START services based on an RA95 code if their age is 6 and above, and if they have a mental health diagnosis. Then it'll also show if the client is on any active registries, if they're eligible for core services, or if they have a Medicaid eligibility alert and need to recertify. So here's an example of the notification section. We have that prescription prior authorization, identifying what medications require prior authorization. We have, looks like they have POP high user and POP potential clozapine candidate notifications with the managed care plan information. Health Home Plus eligibility. So this shows that this client's eligible for Health Home Plus services due to 3 or more inpatient mental health services in the past 13 months, and they have an active AOT court order. And it also looks like they're high mental health need, and you can see the reasons to the right of that notification. Mental health placement consideration due to, so you can see the reasons for that. Core eligibility, looks like they're eligible for core services, and you can use that link to learn more about what core services are. And then an OPWDD NY START potentially eligible notification at the bottom. All right, we also have beneath the notification section an active Medicaid restriction section. So this section only appears for recipients who have Medicaid restrictions. So the table would include the type of restriction they have, for example, inpatient, pharmacy, or clinician or clinic restrictions, the begin date, and the name of and contact information of the providers to which the recipient is restricted. Now, this is updated weekly from the Medicaid database, and again, this would only show if that client has any active Medicaid restrictions. Now, below that section, if it's showing, would be the alert section. And the alert section is organized chronologically and appears only for recipients who have had alerts from DHS and data, NIMERS, and or service invoices from Medicaid. So here's just a list of the potential alerts that could show in this section. We have homelessness, suicide-related alerts, overdose risk, opioid-related overdose alerts, and then positive suicide screenings or depression screenings. So I will show what that looks like now. So here's the alert section, and here we can see that the table includes the alert type, the number of events, meds, or positive screens, the first date and the most recent date of the alert, the provider name, the program name, and the severity, diagnosis, meds, or results. So you can see, for example, this person has homelessness alerts, a positive PHQ-9 depression screening, positive suicide screen. They've had a history of treatment for suicidal ideation, and then opioid overdose. And you can drill in on the far right to that See Details button and see the reporting billing provider, the reporting billing program, the date of incident or service, the medical classification if that's included, and then the source. So below the alert section, we have the social determinants of health. And this section can include societal and environmental conditions that can impact a wide range of health risks and outcomes, such as food insecurity, inadequate housing, problems related to education or employment. And here you can see that this person has a number of social determinants of health, and you can click on any one of these to drill in to view more details. So in this example, we drilled into unemployment, unspecified, and here you can see at the bottom the date of service, the service type and subtype, the provider name that this SDOH was given from, and then any other primary, secondary, and quality flag related diagnoses that accompanied that bill. And again, this data is coming from Medicaid billing Z codes. Next, we have quality flags. So the default view for this section lists each of the indicator sets and quality flag conditions that a recipient is currently flagged for from the as of monthly report date shown at the top of the section. So in this example, the quality flag section as of date is May 1st, 2024. So as of May 1st, 2024, this individual meets criteria for these quality flags. So here you can click on the definitions icon to get a definition of each quality flag, or you can click on the quality flag hyperlink itself to view the definition for that flag. And what you can do on the far right is this is currently showing the recent quality flags, so what they're currently meeting criteria for. You could also toggle over to an all graph or table view to view the history of the quality flags that this person has met criteria for in the past. Then we have our PSYCKES registry section. So the PSYCKES My Choice application allows creation of a client registry to monitor specific clients at risk. So right now, there are 3 registries currently in My Choice. We have the Suicide Care Pathway, the High Risk List, and the State PC COVID-19 Registry. So information contained in this section includes the type of registry, the provider name who placed the client on the registry, the date that the client was added to the registry, and then the date they were removed on, or it would show active if they're still on that registry, and then the most recent registry designation. So for the high-risk list, for example, the reasons that somebody could be placed on the high-risk list would be if they're non-adherent to their antipsychotic, if they have an AOT court order, high hospital utilization, opioid overdose in the past year, if they've had self-harm or suicide attempts or intents. And then you can also select other or not specified. And then all clients will automatically be removed from the high-risk list 3 months after the last saved or renewed date. But clients can be removed at any time manually from the high-risk list as well. All right, so the next section that we have is the plans and documents and screenings and assessments section. So in this section, you can see for plans and documents, you can upload a brand new safety plan, psychiatric advance directive, care plan, or discharge plan, or you could select create new to fill out a safety plan template, which would be the Stanley Brown template, or a psychiatric advance directive PAD template as well. So in this example, you can see that this person has 2 safety plans that were entered in the past, and you can see the date that it was created, the document type, the provider that entered that plan for them, and then who the document was created by, the role that that person had, and if you are the person or the user at that agency that completed that plan, or if you're a user at, for example, AIDS Center of Queens County, and you have consent for this client and can go into their clinical summary and view this information, you'll have a delete document option. Then we have screenings and assessments. So this section will display if an assessment was completed, so a CSSRS, the suicide screening, or a PHQ-9 depression screening. And here you can see the assessment name, the number of assessments entered, the last assessment date, the last assessment provider, the last assessment rated by, and then the last assessment results. So users can see the assessment results based on the client's consent. Then we have the diagnosis section. So here this is split up into the behavioral health diagnoses and the medical diagnoses. And the client level clinical summary includes diagnoses in the primary, secondary, and tertiary level if they're related to a quality flag in PSYCKES. And here in these sections, the diagnoses will be listed in the order of most frequent first. So you can see here that this person has opioid-related disorders as their most frequent diagnosis. So if I click on that, a pop-up will appear and I can see more details such as the date of service that diagnosis was given, the service type and subtype that billed using that diagnosis, the provider name, and then any other diagnoses that were also included on that bill. Here you can also export to PDF or Excel. Then we have the integrated view of services over time, the IVOS section. So this section can present raw data on the client's service utilization for up to the past 5 years. And the graph uses dots to represent distinct services, for example, medication pickups. And then it can use a line to display continuous services, such as, for example, health home enrollment or IMT services or inpatient stays. So the graph also includes Medicaid eligibility at the top, showing the time period during which a recipient was Medicaid enrolled, and identifies any gaps in Medicaid enrollment. And you can see if you, on the top right, you can also, this is the graph view, and you can also toggle to a table view, which would show the date of service, the service type and subtype, the provider name, procedures or medications, and then diagnoses. In this example, though, the graph view, you can also hover over a specific dot or line and see the provider name and that date. All right, next we have the care coordination section, which is different from the current care section at the top of the clinical summary. This section, care coordination, is also showing historical care coordination services that the clients received in the past. So here you can see the service type, the provider name, the first date billed and the last date billed, and here if it says current, like our IMT row at the top, that means that person is still receiving those services, and then the number of bills. And again, you can toggle the section from a table view, which we're on, to a graph view. All right, next we have medications. So these are divvied up into controlled substances, behavioral health medications, and then medical medications. So here you can see on the main clinical summary screen, you have drug class, the drug name, the last dose, estimated duration, and then the first day and last day picked up. And all of these sections can be toggled from a table view to a graph view to view somebody's medication patterns. So you can either click on the details button next to a section header where my arrow's pointing for medication controlled substance. I could click on that details button to see a list of trials and orders for all medications prescribed in the time frame of the clinical summary. Or I could click on, for example, the far right arrow, which is showing me drilling into an antipsychotic medication specifically. So here I've drilled into one of the medications, haloperidol, and you can see there's two tabs here, orders and trials. So the orders tab would include, the orders tab would include the pickup date, the brand name, the generic name of the drug class, the strength of the drug, quantity dispensed, the day's supply, the tabs per day, the total daily dose and route, along with the prescriber and pharmacy. So the orders tab would show each individual pickup. And then if you toggle over to the trials tab, that will display the medications that have been continuously picked up within a shorter period of time. So within 35 to 45 days of each pickup, if the client picks up within that time frame, it would show as a continuous trial. You can also export these details to PDF or Excel. And then I wanted to point out you have that graph view for the medication section. So here you can see in the past 5 years, this person's medication utilization for behavioral health meds, and you can hover over a specific dot to see the pickup date for that specific medication. And then we have medication information. So if you click on a medication itself within the clinical summary, it'll bring you to a micromedics pop-up. And here you can find out more information about that specific medication, such as the doses, the drug name, side effects. There's some patient education on there as well, etc. Next, we have outpatient services. So this includes behavioral health services, and then another section for medical outpatient services. And here you can see the service type, the provider name, the first and last dates billed, the number of visits, the most recent primary diagnosis, and then the most recent procedures if they were included on that bill. So you can drill into the details button at the top of the section to see all related behavioral health services, or you can drill in on the far right to just view one specific service history. And then again, as with most of our other sections, you can toggle from the table to graph view. So here's an example if I drilled into the medical outpatient service, urgent care medical. And here you can see that there's been 2 services. The date of services are showing that service type that I drilled into, what provider provided those services. You can see, along with the most recent primary diagnosis, you can see if there were any other diagnoses associated on that claim, and then the procedure. And here you can export to PDF or Excel. And then just to show an example of what it looks like to use that details button that's right next to the section header, here now I can see all medical outpatient services that this client has been billed for in chronological order. And you can see there's a few pages of the medical outpatient services. And again, you can export to PDF or Excel. Next, we have a crisis services section. So here you can see the crisis service type, the provider that provided that crisis service, an admission or first bill date, and then a discharge or last bill date, the number of visits or length of stay, the most recent primary diagnosis, and then the most recent procedures within the last 3 months for that crisis service. So here you can toggle to the table or graph view, or again, click on that details button to see a chronological list of all of the crisis services the client has received. Then we have our hospital ER section, and this integrates the behavioral health and medical hospital ER services. So here you can see the service type, the provider name, the admission date and discharge date or last billed date, the length of stay, the most recent primary diagnosis, and any procedures that occurred during the visit. So you can see this person has spent some time in the inpatient unit, both for mental health and for substance use detox. And you can see how many days they've stayed in that inpatient unit and what their most recent primary diagnosis was, along with what procedures occurred. You can drill into that specific service if you'd like to see details just for that service, or drill in again to the hospital ER services details button to see that chronological list. Then scrolling down, we have the dental, vision, living support, residential treatment sections. So here you can see the service type, the provider, first and last dates billed, the number of visits, and then the most recent procedures. Living support and residential section has the living support and residential treatment service type, the provider, the first date billed and last date billed, and the number of visits as well. And then a bit further down the page, we have lab and pathology, lab results, EMR, and radiology. So in these sections, for example, lab and pathology, you have the test and panel name, the first and last billed dates, the number of tests, and where that test occurred. So this information can help to determine whether a recipient has been keeping up to date with, for example, their blood tests or screenings. However, in the lab and pathology section, the results of these tests are not available because that information is not included on Medicaid claims. But if you notice the section below, laboratory results state PC, this is for clients who received laboratory testing from a state-operated psychiatric center, and results of the lab results of these lab tests will be available in this section. And the data source for this information is from an OMH database called Cerner, and this is organized by test name and will provide information on the most recent test panel, the number of tests, the first collected date and most recent collected date, and then the most recent results. If they're low or high, the number of abnormal tests, if there was an abnormal test, when was the last one, and what were the last abnormal results, and what's the expected normal range for that test. And then radiology has the test name, first billed and last billed dates, number of tests, and most recent radiology provider. The last two sections of the clinical summary are the medical equipment section and the transportation section. So here you can see the service type, the provider, first billed and last billed dates, number of visits. If there was a most recent primary diagnosis, that was included on the bill, it would show here. And then any procedures that occurred per visit, or in transportation section, it would be the most recent procedure that occurred. All right, my last piece of information about the clinical summary would just be to note, again, you can export the entire clinical summary to PDF or Excel, and you can choose to include the brief overview as a cover page for your export. You can select all available data, which would export the entirety of each section. For example, in that medication section, you would see each script, or in the outpatient section, each distinct visit would be listed as a separate row, or you can just select to export the summary data. And then you have the option for your landscape orientation or portrait orientation. And then if you wanted to just export specific sections, you can use that sections box shown here and click on a specific section. If you wanted to select multiple sections, you would just hold that Control key down or the Shift key and click the other sections you're interested in exporting if you don't want to export the entire summary. And then just as a reminder, this information is protected health information, so please be sure to save it to a secure server or password protect it just for safekeeping. All right, my next slide is about the non-Medicaid clinical summary. So this non-Medicaid clinical summary was added for clients who are not in the Medicaid population, but have either been served by a state PC or have been served by a provider agency that's utilizing the My Choice application, and they've been added into PSYCKES through My Choice. Now, a verbal or signed PSYCKES consent form is required to access a non-Medicaid client's clinical summary. And to look up a non-Medicaid client, you would have to search for them using an individual identifier, such as their name and date of birth or social security number. But for users that are from state PCs, they can also search for a client using their OMH state ID or OMH facility case number. So there's a few data sources pulling into the non-Medicaid clinical summary. We have general demographic information, current care coordination data being pulled in through state administrative databases. We have alerts and incidents. If they're on a registry, it would show in the non-Medicaid clinical summary. You have a plans and documents section for any documents created by or uploaded in PSYCKES My Choice, or from the PSYCKES clinical summary itself or through the iOS mobile app. We also have screenings and assessments, diagnoses, behavioral health and medical, medications, behavioral health services. We have hospital ER information, and then living support and residential treatment. So all of this information is coming to us from our state administrative databases, since Medicaid billing is not included in a non-Medicaid clinical summary. And then here's just a screenshot example of what a non-Medicaid clinical summary could look like. So very similar to our Medicaid clinical summaries, but slightly less data pulling in from, since Medicaid billing isn't included, but we have that state administrative database information coming in if applicable to the client. All right, we're going to talk about plans and documents just to show how to upload or create plans and documents. So users have the ability to upload safety plans, relapse prevention plans, psychiatric advance directives, care plans, discharge plans, or any other type of documentation they feel is necessary to add to that person's clinical summary. And then, as I mentioned before, users could also select Create New in this section to fill out an existing safety plan or PAD template and save it to the client's clinical summary. And then the uploaded or newly created document will be accessible to users at the agency responsible for uploading or creating it. And then other agencies may be able to view that document only with a signed consent or in a clinical emergency. Now here's how to upload existing plans and documents. So you would go to the Plans and Documents section and select Upload. And here you would select what type of document you're uploading, and you can see the list there. And then beneath that, you would select the date created, who it was created by, and their role. And then you would choose the selected file you're looking to upload. And then lastly, click Upload. And here's an example of us uploading a psychiatric advance directive. And there it shows the date the document was created, the document type, the provider name, the document created by, and their role. And then to create a new plan and document, you would select Create New. And here we have two options to choose from for our templates. We have a safety plan and psychiatric advance directive template. So in this example, we've clicked Safety Plan, and here I can fill out the required fields and then click Submit once I'm all done. And then you can see that safety plan reflected in that person's clinical summary. All right, I'm going to end today's training with some training information and technical support. So we have a lot of different PSYCKES resources on our website at psyckes.org. We have our user guides. We also have plenty of other webinars that are recorded with their slides on our website as well, along with our quality indicator definitions and our release notes for our past new features that we've had. So it's a great place to start if you're looking for more information about the application. If you have any questions regarding the PSYCKES application specifically, you can reach out to our help desk. We're available Monday through Friday from 9 to 5 at psyckes-help@omh.ny.gov. If you're having issues more specifically with your token or with logging in, that's where you'll contact the ITS help desk if you're an OMH or state PC employee at at its.ny.gov. Or if you're an OMH employee, or if you're a non-OMH or non-state PC employee, you'll contact the OMH help desk, and that email address is healthhelp@its.ny.gov. So they'll be your resource for any token or login issues. But if you're not sure who to contact, please feel free to contact our own PSYCKES help desk, and we can point you in the right direction. Well, thank you very much for listening into today's training, and I hope everyone has a wonderful day.